In the third presentation of this module, we are going to start thinking about how we can be more disability inclusive in our practice in healthcare, and we will be building on this knowledge over the course of the remaining modules. An important resource in your community that you may or may not be aware of are DPOs, or disabled persons organisations. They may also be called OPDs, or organisations for people with disability. These are community organisations whose members are people with disability and sometimes also includes their families or caregivers. DPOs work to ensure the rights of people with disability are realised and upheld. They may play a representative role, undertake advocacy, provide services and peer support, and may contribute to research. Through partnerships with DPOs, health services can actively involve people with disability in awareness-raising activities, in identifying local barriers to health services, and in developing strategies to improve access to health services for people with disability. Researchers, NGOs, and UN agencies have highlighted some key principles to achieving disability inclusion in health services. The first of these principles is to increase awareness among all health staff of the rights and needs of people with disability. And this means all staff, including health workers, orderlies, receptionists, cleaners, security guards, managers, and anyone else working in a health facility. This is key to changing attitudes and practices toward people with disability throughout the entire health service. This can be done by providing training for all staff and developing specific policies that support people with disability to access healthcare. Secondly, services can become more inclusive by actively involving people with disability at all stages of health service planning, implementation, monitoring, and evaluation. One way to do this is through establishing partnerships with your local disabled persons organisations. Among other things, they may be able to support you to provide disability awareness training for your staff. Third is through taking a comprehensive approach to accessibility. Increasing access to health services for people with disability is not just a matter of installing a ramp at the entrance or grab rails in the toilets. It is necessary to address physical, communication, policy, and attitudinal barriers. As we work through the modules of this toolkit, we will learn about each of these types of barriers in more detail and some practical strategies to address them. In addressing accessibility, it is important that we also pay special attention to the specific needs relating to gender and diverse ethnic or minority communities who may have differing experiences of disability and, as a result, different barriers. It is also important that we take a life course approach to healthcare for people with disability, recognising that, like everyone else, people with disability have health needs that change throughout their lifetime, and what may be appropriate for a child or a young adult may not be appropriate for an older person. And finally, disability inclusive health requires a twin track approach. By this we mean that for people with disability to realise their right to health, there needs to be 1, a disability inclusion within mainstream health programming. That is, ensuring that existing and future health activities are inclusive and meet the mainstream health needs of people with disability. And 2, disability-specific health programming to address the specific needs of people with disability that may be hard to reach through mainstream programs. Now that we understand these key principles to disability inclusion, it is time to start taking some practical steps to improving disability inclusion in your health service. We suggest that after completing this training module, you take these 2 steps. First, find out who your local disabled persons organisations are and contact them. Invite them to meet with you to find out more about how they can support you in becoming a disability inclusive health service. On page 17 of the toolkit manual, there is a guide to partnering with DPOs that may be helpful to refer to. The second step is to look at the checklist on pages 18 to 20 of the toolkit called First Steps in Making Your Health Service More Inclusive. Use this to do a quick scan of your service and begin thinking about areas for improvement and what you would like to prioritise. Each of the sections on the checklist will be covered in more detail in other modules, so by prioritising areas to address, you can identify which of the modules will be most helpful for you to do next. We have now reached the end of Module 1. We hope that at the end of this module, you have taken away these key messages and are ready to share them with your colleagues and work to make your health service more disability inclusive. Now return to the workbook to find some more information about your next steps.